Well, thank you, Dr. Oliver, for joining us today. We really appreciate you being willing to accept the honor of being our individual children's champion this year. Excited about the opportunity to highlight your work at the luncheon that we'll be having on May the 2nd. And look forward to meeting you in person and having, a conversation just to get to know you. You can get to know us. But I thought that we would start this interview out with you telling me a little bit about your work and what inspires you.
Well, thank you for this opportunity and for this honor. I truly do appreciate it. So I have a few different parts of my identity in my work. First and foremost, I'm an OBGYN physician. So I've dedicated my career to taking care of women, bringing babies into this world with those families, and committed to a good start for those children. That has been the bulk of my career, is focusing on individual patients and my practice in general. But for the last few years, I've done more physician leadership across Novant Health. And so now I have the pleasure of leading our physician network. So all of our clinics and our clinical teams across Novant Health. And, the impact of that really is being able to make sure we deliver high quality care, that we tackle tough problems for patients to make sure they can thrive and have their healthiest life that's possible and that they desire. And then most recently, one thing that I'm really passionate about and now have a more formalized leadership over is health equity for our system. And that is working with an incredible team and great leader in looking at how we as a health system show up to break down, to tackle disparities and break down issues within our system, or work within the community to break down issues that could impact the ability of anyone in our community from having the highest quality care and highest level of health that they could possibly achieve.
As a user of the Novant system myself, I will say that I've noticed a difference between maybe 10 years ago and now, that the person who provides my primary care, she's a physician's assistant, but she actually spends a little more time with me. It's not as rushed as it used to be. And so for me, it makes me feel like, she's really concerned about me and my health, and is always on top of me about, you need to lose weight, you need to be more active, what are you eating? And so I think that you all are doing a great job in that respect of being, showing patients that you care and really being concerned about the health. So I appreciate that.
Well, that's what matters, that you see it and feel it.
And I do. But actually, my whole family goes to Novant, and my girls are also my twins. They're women, 29, but they also use the same person. And she's like, "How are those twins doing? Tell them they need to get in and see me." And so, really being concerned about the whole family, which I think is great. So tell me, what has been the proudest moment in your career regarding working with children, families, or early education professionals in our community?
One of the initiatives that I was most proud of probably, and that really spoke to my sense of mission and purpose, was being part of a team that started a home visitation program, a nurse home visitation program for any woman who delivered a baby at Forsyth Medical Center. And we visited a similar program in Durham and really wanted to bring something to Forsyth County that would be open to everyone, and that would provide additional support for new moms shortly after childbirth. And we set up a team of nurses who actually went into homes. Patients would accept the visit and they would go into the homes, and these nurses would do assessments, and they would screen for postpartum depression, which we know can impact the entire family. They would do an assessment of the home and identify issues with maybe a lack of smoke detectors, or a lack of adequate bed sleeping arrangements for the baby, or just anything that could impact the mom or the baby. And they do a health assessment, whether it was from breastfeeding, tackling breastfeeding concerns, or mom's blood pressures, or all of those types of things. And I was part of, helping establish that here at Forsyth. It has evolved now to be called what we call our First Steps program. I got to participate in the weekly case conferences where the nurses would bring some of the most challenging, report outs to the group. And we as physicians would help to identify what do we think we should do to help and support that family. And it was outside of traditional healthcare. It really was around how do we wrap around these new moms and these new families, the many, many resources that we have within the county that we don't necessarily own or control, but that we have incredible partners to help with. And just hearing the need that some of our patients and community members have, and how our team was part of connecting the dots to make sure that we could help those new, sometimes new moms, or sometimes, families that were extending their family, how we could help them and get these babies off to the best start, because we knew that it all starts at birth. I hand that baby over at birth, but this was an extension of trying to make sure that I was part of a good, healthy start for these babies within our community. And it was definitely the thing that filled my cup, I would say, a lot. Was going, it was tough topics to think about what people are challenged with, but it was really, really rewarding.
Yeah, we get referrals from that program at Child Care Resource Center. We, as helping families find childcare that meets their needs once they have the baby, then that becomes a concern, particularly for working moms. And then we've also began focusing on family, friend, and neighbor care activities, because we see that a lot of children in our community aren't in any type of licensed care, but they still need that early education opportunity to help them get off to a good start and help their families understand what they're supposed to be doing. So really excited about First Steps, was excited when it came to our community. And I think that's great that, you were a part of helping to bring that to Forsyth and helping to make that be successful in our community. I think a lot of parents appreciate it. And again, it's going back to that, making them feel like healthcare is there for them, and that, somebody is concerned
Exactly.
about their well-being. So I think that's great. So thinking about your career, who has inspired you throughout your career?
That's really easy. I come from a family of strong women and strong matriarchs. And so it's easy for me to say that was my grandmother and my mom. I grew up in Eastern North Carolina in a very rural community, Rocky Mount, and my family was in Nash and Halifax County. And my grandparents were farmers. And we very much had a large family. And even where people didn't have significant resources, or you could say they may have lacked in some areas, there was always love and support. And I came to value what it means to be part of community. Everyone kind of would dig in to help each other. So when we were growing up, our extended family helped take care of us when needed. We would take care of, cousins and others when needed. And that meant a lot. And I think it was that sense of, I have this history, I say, of being part of a family with such a group of caregivers, that's probably in my DNA and in my soul. And I think that, what I learned from them was you take care of each other. And when you help take care of others, then someone will help take care of you. It will be paid back in dividends. So I would definitely say it's the two of them. And that probably helped lead me towards a career in medicine that very much is about taking care of people individually, to this role that I'm in now, which helps me to think about bigger. It helps me think about communities, even beyond the individual level, and to my work in the community, which is all about, we are rich in resources collectively. And how do we then help anyone who may be in need? so that we can all thrive.
Mhm. It's interesting, you think about Eastern North Carolina as being a rural, smaller part of the state, but how many people I run into, because my grandmother's family is from Williamston, which
Oh,
is
yes. Mhm.
yeah, down there in Washington, Martin Pitt, Washington County. And so how many people come from that part of the state
Mhm.
who are doing this good work. And so
Exactly.
it's interesting to hear that. Could be cousins, who knows?
We probably are. We probably are.
So just tell me, you talked a little bit about your who helped inspire you and the work that you do, and what do you love most about work? I think we've heard that, but what do you love most about the work that you're privileged to do in the community?
Yeah, for me, the end result is impact. I love
Mm,
to see things come together, and the ultimate impact that it has, either at individual level or more collectively. And I would also say, is connection. I'm a connector. I really feel that you don't do anything really alone. That it takes a village, it takes a community, especially to solve some tough issues. And I feel that in Winston-Salem and in Forsyth County, we're actually a community that's very rich in resources. There are a lot of great organizations and people who have a heart for the work that we truly need to help those who need it, right? And yet sometimes it can be very challenging for people to either
mhm.
find access, or benefit from some of that work. And so, I love to be able to understand, make the connections across the different areas that I may work in to try to optimize the impact, honestly, because that seems to me a huge opportunity that we have as a community, is to say, how do we all fit together like pieces of a puzzle versus being, in competition. We're not, First Steps program is not in competition with,
Mhm.
Child Care Resource Center or anyone else. We actually collaborate really well. So that collaboration, connectivity, and then ultimately all that leading to impact is really what drives me.
Right. And you find a lot of families listen to their medical professional. And so just having a person saying you need to do this has been really helpful in having families think about what their next steps are once they have a child. So I think
Mhm.
that's great. Challenges. What do you see are the biggest challenges that are facing our community related to moms, children, early education?
Yeah. Well, I have to start with probably affordability and access, right? We saw this as a health system with, we're probably the second largest employer in Forsyth County,
Mhm.
um, by sheer volume of our teams and our facilities and our clinics. And during the pandemic, especially, we saw a huge strain on our teams
Mhm.
who needed childcare. And there were many reasons that childcare was interrupted during that time period, but even coming out of it, have been challenged to be able to afford childcare, and or to find it, even if they can
Mhm.
afford it, find it and have something that they think is consistent, is safe, and provides their child with the experience they need. And I think that's a big challenge. And the reason that it concerns me is I'm a huge advocate for women,
Mhm.
and women both in the workforce and women in leadership. And I know that women who choose to have families, this is something that truly could impede their ability to either stay in the workforce,
Mhm.
to compete and to grow in their roles, and to become future leaders. And that bothers me. And I know that when I had my children, I have 3 children, they're now teenagers. But every step along the way, it felt like the most stressful thing was childcare. If I
Mhm.
knew someone who was actually helping us was making a transition and we had to figure it out, it is incredibly stressful. And we were blessed to have backup because we had family. We were blessed to have resources so we could afford. It was more connecting the dots and finding it. And I think about how overwhelming it is for women in our community or families in our community who want to do right, who want to, sustain their work or improve themselves in their careers, and yet this is such a challenge. So that's the first thing that I really think is the biggest challenge we have.
Mhm. Yeah, I was talking with our other honoree earlier, and I said, I started this work in before 1990, 1986, around there. And this was a challenge then, not as big as it is now, but we've lost quite a few childcare programs, especially in Forsyth over the past couple of years, some of the larger, church-run programs, simply because it is expensive. This is an expensive undertaking. And then trying to find people, the right people to come into the field to care for the children who have the qualifications. That's a challenge, being able to pay them. And so we've got to figure out how we do this across our country and in our community. Other developing countries do it differently.
Mhm.
They really support families and children from the very beginning. There are resources there to do that. And so we've got to figure out how we do that in our community as well. It's just, you can't expect people to pull themselves up and do it for themselves. It's like when children are born up until they turn age 5, then it's like, oh, families need to figure it out. But then when the kids go to kindergarten, it's like, oh, okay, here we are all day, able to help the families and provide some type of education, when we all know education begins at birth. And so
Well, it's
some,
interesting, being in healthcare, it may sound odd for me to say this, but most other countries have the reverse spending pattern than what we have. They
oh
actually
wow.
pour more resources into, children and social programs for
Hmm.
support and need less when it comes to healthcare. And,
Hmm.
that makes sense to me because if we think about it from a public health perspective, if we get our children off to a healthy start, if they truly have, if we reduce the adverse childhood experiences,
Hmm.
if we actually allow them the, opportunity to thrive in education early on, I guarantee you we will need less when it comes to healthcare spending down the road, right?
Right, right.
And yet trying to figure out how to right the ship with some of that seems to be challenging right now for us as a nation.
Hmm.
And yet it's something that if we don't address, I think will become really overwhelmingly um, um, a challenge for us.
Right. And I think it's overwhelming us now. And so we've got to jump in and figure it out. Um, so how do you hope to impact children and families in the future? You talked just a little bit about, the challenges and what you love doing, but just thinking about the future, what change do you hope to see?
Well, I think there's an individual level. There's a lot that I could do and others can do, whether it's through volunteerism and supporting programs that support families or support children, um, or just active, engagement in programs at whatever level. And then I do think about the role I have as a leader and as a community member with connections where it comes to advocacy, to truly help figure out at legislative levels or even with corporate entities how we raise or raise the issues that currently impact the ability of our families to thrive. And a lot of that is related to resources that we need for children, for them to make sure their children are taken care of. So advocacy at the legislative level, state and national, something that I've embraced for healthcare, what's considered traditional healthcare issues. But coming out of the pandemic, I was able to have conversations with our Congress, few Congresswomen about this issue related to what we saw with our own teams and how we had to step in to try to find solutions as a health system, find solutions for our teams related to childcare. And so I can definitely do more when it comes to advocacy, because I don't think that these changes are all easily solved without more resources that are committed at a local, at a state or a federal level.
Right. And we have some resources, but can't, they're already spread thin. And so it's how do you add more to that to make what we have work? Because I think we have systems in place that could work, but
Mhm.
you really they've really got to be supported some way, somehow. So glad to hear you say that. I think we're on the same page. We need
Yes,
to
takes a
be-
village.
Yep, it does take a village, definitely. So, is there anything else that you'd like to share with me today about your work or your hopes, your dreams? I really do appreciate you taking time out of your schedule to talk with me about, and share about yourself and what you've been doing in the community.
I would just tell you, I give you a story, that's kind of irony. I told you I have 3 kids, and my twins are now 17, but
No, I
when
have
they were,
twins.
yeah, they're 17 and they're a little bit behind yours, but they, obviously I was starting private practice as a OBGYN physician. I was gonna need to be on call, and leave them with my husband, and my mom helped out for a long time because, like I said, I had resources and support for that. But we obviously were looking at what we could do around childcare, what our options might be. And I actually utilized Work Family Resource when that was the name of the
Okay.
organization, to help connect me with potential caregivers.
Hmm.
And so thinking about that 17 years later, or almost 18 years later, and coming back around and receiving this honor means a lot, because I can tell you that like I said, my world can be stressful just by the work that I do, but trying to figure out how to show up at work, I needed to make sure I had my children taken care of.
Hmm.
And it seems like that is a recurring theme that I feel we've had, and my colleagues have, and my patients often would, they come in for their visits, and we spend more time them asking me, how did you find someone to take care of your child?
Hmm.
What can you recommend someone or something? And so I know the challenge that it is to really make sure families and women have options so that we can show up, or our families show up in our careers, and really thrive. So I really appreciate the work that you all do to make sure that we have enough, that people are connected to it, that it's high quality, and that you continue to advocate for families across our community.
Oh, that's great. Thank you for that story. I started when we were Work Family Resource Center, and really how I came to this work is because I was, a young mom, single mom who needed help finding childcare, and I started working at a childcare resource and referral agency in Charlotte, and I was like, this is work that I could do forever. And so I've changed to a different agency, but it's still work that I think that I could, do forever, because it's so important for families to be able to access childcare and have somebody there who can help guide them. So I really appreciate that.